How to use research like a sword and a shield in MedMal cases. It's not just what your expert says in court or a deposition, it's what they cite that often wins or loses a case. And if they use the wrong kind of research, well, that can be like bringing a knife to a sword fight. In medical malpractice cases, experts often feel very confident in their opinions. But sometimes the credibility of those opinions can crumble quickly when the supporting research just does not match the legal task at hand. And judges, and especially opposing counsel, they are absolutely paying attention. I've seen experts absolutely hammered because they use the wrong type of source for the task and the goal. So I came across an article that was recently published in the European Journal of Dentistry, and I think it's a really powerful source for expert witnesses, and it has this really handy-dandy chart that I'm going to go over. Now, before you turn this off and you say, look, I'm not an expert in dentistry and I'm not a European expert, trust me and bear with me, this is absolutely pertinent to you, so continue to watch, please. The article that we're looking at here was published earlier this year in 2025, and it's from the European Journal of Dentistry. The title is Dealing with Evidence in Dental Professional Liability Lawsuits, General Recommendations for Dental Expert Witness Work Using the Example of Germany, a Narrative Review. And like I said, doesn't matter that you're not a dentist, doesn't matter that you're not a European expert. There's a lot of gems and gold to be mined from this article. This is the biggest takeaway I want to draw your attention to. And this table I just feel like is a really good resource for experts. And the column on the left, it describes a type of expert witness assessment. And then the columns on the right, they are listed as standard textbooks, national peer-reviewed dental journals, we'll disregard the dental part, so just national peer-reviewed journals, guidelines, or international peer-reviewed journals. And they give recommendations on whether that particular source would be particularly appropriate, or not really appropriate, or less than recommended that you use that. So for a general explanation of the clinical management, standard textbooks are the best to go to, and you can also, of course, guidelines are good, and national peer-reviewed journals are also good. It's not really recommended that you use like international or foreign peer-reviewed journals. The next assessment category, definition of medical standards. Standard textbooks are great and guidelines are great. And you can use, occasionally, depending on the context, you can use other peer-reviewed journals. For medical malpractice, standard textbooks, they're okay. They are appropriate, but not the go-to. Guidelines should be the go-to. And then, depending on the context, you can use articles, of course, peer-reviewed articles. In the matter of scientific justification of causal relationships, international peer-reviewed journals should be the go-to. And guidelines, you can use those. Those are also appropriate. And textbooks are not really recommended or less effective in this case. And also true for like smaller national, peer-reviewed journals. When it comes to your assessment of gross medical malpractice, both utilizing a standard textbook and guidelines are particularly appropriate. And then also national and international peer-reviewed journals are also appropriate. So here's the key or the takeaway that I want to leave you with in this short video. Make sure that you match the evidence to your mission or the type of assessment that you're focusing on. If you're explaining a procedure, a textbook is great, especially for a jury. It's going to make it more accessible. If you're trying to prove a general acceptance, cite a guideline. If you're making a causation claim, reach for a high-quality systematic review or a meta-analysis. So evidence isn't one size fits all. It's a toolkit, right? And some tools will get the job done, although they're not the best one for the job. And of course, you want to use the perfect tool that is designed exactly for the task at hand. I'm Michael Graham of Graham Med Legal Research, and I help attorneys and expert witnesses by performing comprehensive, exhaustive literature searches to find, vet, and apply the right kind of evidence so your report is sharp enough to cut through scrutiny and strong enough to withstand an attack. If you're ready to use research like a sword and a shield, let's talk. If you'd like the article that I outlined in this video, send me an email or reach out to me through LinkedIn or my Substack, and I can get you a PDF copy of that. So until next week, stay sharp.